Hi everyone, my name is Dr. Solmaz Emyonazmi and I am a board-certified internal medicine physician and lifestyle medicine specialist practicing just outside of Boston, Massachusetts. Today I wanted to talk to you a little bit about COVID-19 and clarify some questions that my patients have been asking me and that you may have too. So just to summarize, COVID-19 is in the family of viruses known as the coronaviruses. Coronaviruses have been around for a very long time. They cause things like the common cold, but they can also cause more serious illness. If you remember things like SARS and MERS, coronaviruses were responsible for those. And such as COVID-19, it's a type of coronavirus that has been causing critical illness and in some individuals causing death. The virus originated in China in December of 2019 and has been classified as a worldwide pandemic. Basically has spread throughout the entire world. So it's basically a respiratory syndrome characterized by things like fever, chills, cough, shortness of breath, body aches, muscle aches, joint aches, and more recently we are seeing more gastrointestinal manifestations as well as dermatologic or skin manifestations and changes. We're also seeing patients presenting with things like anosmia or loss of complete smell. Currently, we don't have any treatments available, unfortunately, for COVID-19. There are about 150 different medications being tested throughout the world right now. Most of them are drugs that already exist and that are used for other purposes that we are trialing currently on COVID-19. But nothing at this point has emerged as a promising, proven treatment for COVID-19. What we can offer our patients is symptomatic relief. So when our patients have symptoms, we, depending on the severity, if we try to get them to manage the symptoms at home, such as taking Tylenol to bring down fevers, and sometimes we prescribe albuterol, which is typically prescribed for asthmatics. This is a bronchodilator, or in other words, it opens up the airways, improving gas exchange and hence oxygenation. We use this for our patients who have more respiratory symptoms such as cough, shortness of breath, wheezing, and has been giving our patients some relief. We've been encouraging them to continue to drink, hydrate well, drink fluids, lots of water, lots of teas, just to stay well hydrated. I wanted to address why we're all staying at home right now. We're staying at home because this virus has been behaving differently in different types of people. There are asymptomatic carriers or patients who have absolutely no symptoms but they are infected with COVID-19 and they are continuing to spread this via respiratory droplets. So it's really important that we stay at home because we want to protect our communities, specifically our vulnerable populations, and our vulnerable populations are defined as patients over 65, patients with pre-existing conditions such as diabetes, heart disease, hypertension, obesity, and I just want to be clear that COVID-19 is causing critical illness in a wide range of age groups, but it is predominantly causing illness in our vulnerable populations. So it's really important that we stay at home. If we don't need to be at work, we stay home, and that we try to only go out if it's absolutely necessary. So the other part of that is social distancing. If you do need to go out, like you need to go out to the grocery store, or if you need to go in for an appointment, for like a doctor's appointment that you need to be seen face to face, or if you want to go outdoors, it's, for a walk, for example, on a trail, it's important that we practice social distancing. So we try to keep a distance of 6 feet apart from individuals. It's a good idea when you're going to be in a place like a grocery store, always to have a mask on, because that protects others from becoming exposed to your respiratory droplets. Those are droplets that are secreted from your mouth when you sneeze, when you cough, when you speak. Sometimes little particles can come out when you spit. So it's really important that you make sure that you have a mask on. And then that brings me to my next question that patients are asking me: can I go outside? You can go outside. It's good for your mental health to go outdoors to your backyard or to take a walk outdoors. But if you are going to take a walk outdoors, Try to go places where there are, they're not populated places, and if there are people, please respect the social distancing. Please, move to the other side of the street, or, try to keep your distance from individuals on the trails that you're walking on. I also wanted to talk a little bit about who should be tested. So everybody wants to know if they have COVID, very understandable, but unfortunately we don't have enough testing kits for everybody. So the people who have priority 1 testing are any patients who are hospitalized. They need to be tested for COVID. And then patients who, basically individuals who are healthcare workers and have symptoms. And then priority 2 testing are patients in long-term care facilities with symptoms, patients who are 65 and older with symptoms, patients with underlying conditions like I mentioned, diabetes, heart disease, high blood pressure, who have symptoms, and then first responders with symptoms. So those are the people who should be getting, they have priority 1 and priority 2 testing to get tested. That brings me to my next question about antibody testing. So everybody wants to know now, initially everybody wanted to know if they have COVID. Now everybody wants to know, do they have antibodies to COVID? Could they have maybe been an asymptomatic carrier, established antibodies, or were they infected? Did they at some point have COVID? Basically, the thought of antibody development to a virus is when you get exposed to an illness like a virus, the body creates proteins known as immunoglobulins or antibodies, which basically protect you. They protect you. They're supposed to protect you from getting an infection in the future. So you mount this immune response. The problem with these antibody tests is that we don't have a really good one available. We don't have an approved good test available. So if you order some of these online antibody tests, the chances are highly likely that it's not going to be an accurate test, and it's going to have a high rate of false positives or a high rate of false negatives. So that's one problem. The next problem is we don't know if mounting an immune response to COVID, i.e. developing antibodies to COVID, is actually indicative of immunity to COVID. So that poses another question. And then a third layer of complexity to add to this is, let's say it does indicate that you're immune. Let's say the presence of antibodies does indicate that you're immune. How long does this immunity last? And when does it wear off? Basically, the thought is that if once it wears off, are you susceptible for reinfection again? And there have been some cases throughout the world that we've been reading about where patients are getting reinfected with COVID-19. So I strongly suggest that you avoid embarking on antibody testing right now until we have a good test available. But if you do, then you should definitely discuss the implications of the results of the test with your physician, because there's a lot of layers here to discuss. And finally, I just wanted to just say, please continue social distancing. Please continue to stay at home. We are discussing flattening the curve. We want to reduce this exponential increase in the rate of infections. We want to make sure that our hospital systems can handle the volume of sick patients. And what happens is if we do not continue to practice social distancing, then the hospital systems will become overwhelmed with sick patients, and then healthcare providers are going to be basically stuck with these very horrible decisions of having to decide who gets the ventilator, who doesn't, who survives, who doesn't survive. And we want to make sure that our hospital systems can handle the patients and the patient volume. So please continue to stay home. Do it for your mother, for your father, for your grandparents, for your uncles, aunts, brothers, sisters, families, people that we love, care about, our vulnerable populations. It's so imperative that we all continue to practice social distancing, staying at home. Thank you so much for listening, and I hope you found this video helpful. Please stay well and stay safe.